do your wound culture, and then you're gonna, oh, you know, I need a checks too. I'm gonna borrow one of these up here. Borrow one of your checks. When are we doing this checkup? Wednesday. Right? No, Thursday, Friday of next week. Because we're going over it this Friday. So Wednesday you will be doing your checkup. Does that make sense?
No.
We go over it, lecture Friday. You practice.
What were
check
you
off on
injecting
Wednesday.
into? What were they injecting
Yes.
into?
We did all of our injections like that. That's why they're shut down now.
Into yourself.
Where'd you go?
To one another.
Yeah, where'd you go?
It's out by Skokie. It's something else now.
I went to Sanford Brown. They're closed down too because we used to do that stuff too.
Yeah.
You're gonna go ahead, you need tape. Keep in mind, the patients are sometimes allergic to regular tape, so you need paper tape. That's the only reason I have the paper tape in here, is just to tell you that. See, now you're getting it too.
I know you got it.
Okay,
Alright,
better get
so
those
what you're gonna
vitamin C
do,
drops
I'm
in.
gonna make sure this is as clear as possible. We'll go over the supplies that you need, in addition to your PPE, because you're gonna have your PPE on. We'll go over that on Friday. You need your chucks, you need 2 4x4s, you need your saline, you need your Culturette, plus you need the bag that it's gonna go in. We'll verbally say we have a requisition in there, because you never send anything to the lab without a requisition, they get very upset with you. You need your sterile gloves. For the checkoff, I will not have you measuring it, but you will verbally tell me if you're measuring it, how you're going to do that. So that's what this is used for. These are one-time use only, you throw them away. You have your tape, and then you have your biohazard bag. So you check on your orders to see that a wound care is needed. You need a culture, because that's gotta be an order from a physician. So on Friday, I will show you where you can find the order in your medication order sheet, on the physician order sheet. You're gonna wash your hands, gather your equipment, bring all your stuff into your room. You're gonna do just like you normally would. So you're gonna knock on the door, you're gonna say hi, hand hygiene. My name is Chris. Can you tell me your name and date of birth? So you're gonna do that, making sure you're checking the wristband as you're going into the room. I am here today to do a dressing change on you. Now again, you guys are gonna be a little different because you're gonna have to do it in HPS with PPE. So you're gonna have to put all your PPE on before you go into the room. So if you forget something, what are you gonna do? Call light on and ask somebody to bring it. Absolutely. Does that make sense?
Mm-hmm.
Alright, so going into the room, we have all our supplies, we explain the procedures to the patient. If we have a deep wound, we wanna make sure that that patient has already been medicated 30 minutes before we go into her. But this is gonna be a superficial wound. I do want you to verbally say, if this was a deep wound, I would have made sure she was medicated 30 minutes prior. Because it can be very painful. So then what we're gonna do, we've already washed our hands, we're gonna make sure we put this bed up so that it's comfortable for us, right? Then we're gonna have to expose the patient. I believe she's got a left leg wound, so I'm gonna need to get over on your side. We would have washed off our table. We're going to position our patient appropriately. Now, I don't take off all the blankets, I just expose what I need. I'm very cold all the time, and I'm very, very sympathetic with my patients. So we're gonna bring her leg out. We're gonna go ahead and put the chucks underneath her leg, because we are going to be irrigating it before we get our wound culture. I'm going to set up.
She's got perfect pointed toes.
Yeah, nobody has toes like that, right? I open up my red bag and I put it down here at the bottom of the bed, so that I don't contaminate anything as I'm putting the dirty dressing in there. I'm gonna go ahead and put on my clean gloves. Again, this is already washed. I'm gonna put these in order of my use. We used to be able to take the tape, cut it off, and then put it on the side of the table, but they don't want you doing that anymore. Because this table's not, it's not clean, sterile, and so they don't want us doing it. I'll have my gloves here. I will have this over here, because I'm going to go ahead and use this first. Again, waist high, has to be waist high. So now we're ready to go ahead and get started. getting tape off when you have gloves on is like nearly impossible. So do practice that. And I always kind of like, when I put the tape back on, I'll show you a special way that I do that. But you always pull your tape off towards the wound. Why do you think that? I mean, I know you guys haven't done the tapes yet, but why do you think you pull it towards the wound?
You don't,
want to peel any skin away from the wound.
Because why?
Because that'll rip the wound.
Right. Now the videos are going to show you, they want you to take the dressing off so the patient can't really see it. And then you assess your dressing. And you would describe it. So you guys know what sanguinous is, and whatever you're seeing in your wound, in your dressing, you're going to make sure you document that. Small, moderate, large
is there
amount.
anything in there, or are you just talking?
It's not, there's nothing. So you describe the drainage, color, odor, consistency, amount. Same thing with the wound. You're looking at that wound. Now I'm going to go ahead and get rid of this. If this was saturated, gloves off, wash your hands, put new gloves on. Clean gloves at this point because we're not doing anything sterile. The next thing I'm going to go ahead and do is I would go ahead and measure it. Hopefully this will go away. If this was nice and round, I could go out by diameter. It's not. So, how do we measure it?
Length and width.
Length, width, and depth. Inches or centimeters? Oh. Too much Posay's will drip. Longest looks to be about 8 centimeters. Widest about 5. Sorry guys. If it was deep, how would I measure it?
Cotton applicator.
Is that?
The cotton applicator, I would.
Yes. And this one's not deep, so I can't do it on this one. You would take a cotton applicator and you would go in, mark it with your thumb or another Q-tip, and then you would lift it, measure it up to your measuring device, okay?
So you're measuring this right here, right? Or-
No, right now I'm not measuring anything, it's that
Oh.
deep.
No, I'm saying when you were measuring the length,
The whole
the
thing.
whole thing?
Yep.
Okay, I wanted to make sure.
Yep, the whole thing.
Okay.
Now if this was just a little red, I wouldn't measure that.
Okay.
But this to me looks like it's supposed to be the whole wound. It looks like the tape has been applied and it's gotten. Otherwise, if this was just a little red, I would measure just from here to here, if that was the actual wound. All right? So, then what you're going to want to do is we're going to do a wound culture. So you're going to go ahead and spray this from top to bottom. Her top, head to her feet. Cleanest, dirtiest. Feet are always considered dirty. Top is always considered clean. So in a zigzag fashion, you would go ahead and we're just going to simulate that part of it. We're not actually going to get it wet. So we've irrigated it. Now at this point, we may want to consider using gauze just to pick up some of that excessive water. Why do we wash it, do you think, before we go ahead and do a culture?
To get any debris out, any outside factors.
Now, a lot of people, sometimes there'll be pus sitting on there and the pus will come off. Do we want the pus? No. No, you don't. Why? Because it's dead tissue. Is that dead tissue going to grow? Nope, dead tissue does not grow. So you don't want pus in your sample. You want to go directly onto the wound itself, the nice wound bed, pick up the bacteria from there because that's where the live bacteria is. And we're going to do that in a zigzag fashion. So if I brought a second one here, so if you want to, if you're going to dampen it, that's when you would dampen it, after you irrigate. So we don't need that anymore. There are different culturettes for different types of cultures that you're growing. So what I usually do is I open this up like a banana peel, I will remove this, and sometimes you have a cap on here, and then this is actually sitting next to it. You have to remove the cap, and then you can go ahead and get your culture. So again, a zigzag fashion from the top to the bottom. Then you put this back in your culturette. With some of them, there's a medium in here, and you have to break it so that your your bacteria will thrive. And then they will put it on a petri dish in the lab. You always make sure you have your patient label on here. This goes into your bio bag. Close it up with your rack. So we'll say that that is done. So I'm all done, and you're not generally going to have all this stuff in here. Take off my gloves, because now I want to become sterile, right? Does my sterile gloves go in here? Red bag? Unless it's pourable, drippable, flakeable, it goes in the regular trash bag. Wash your hands again, and then I'm going to open up my sterile field. So I open up my dressing first, because you're only going to need one dressing to put on here. I'm starting it just like I did when I was putting my sterile objects on to my sterile field. You're going to open it in one smooth fashion away from you, never going over your dressing. So if you guys want to do it with two or practice with two of them, that's fine. But you're never going to go back over your dressing. And you're never going to let this close up. If this closes up, it's contaminated. So you got to get another one. So then I will open up my sterile gloves, just like I did before. Top first, bottom, side to side. Again, as flat as you possibly can. Again, we're going to go through the cup, lift it up, pull it back. Second one, never let your hands fall below your waist. Holding on to my wrapper, up, back. Now it did not go on as nicely for this one, so I'm sterile, so I can go ahead and move my fingers. Again, you can pull on your palms, make sure this is nice and tightly on your fingers, but you can never touch your wrists, ever. I'm going to go into the center of this, pick it up, and place it on my patient's leg. That's the sterile part. Do I need to be sterile anymore? No, I'm all done with the sterile part of it. So then what I do, I pick one area, I make sure I'm partially on my gauze, partially on my patient, and then cut it. Some tape is easier to apply than others. Big thing is you want to make sure that this dressing is not kind of moving back and forth on the wound itself. So then I'm going to go over the tape that I just put this on. See how I did that? So this one went here, and then I went over that one. Kind of going all the way around it. I'm going to do the same thing here. This is over this tape too. Make it nice and smooth, especially for your older patients, because it can damage their skin and cause further skin breakdown. And then on the last one, I fold over the top a little bit, so it's a little bit easier to start and get it off. Again, I'm going over this piece of tape, and I'm cutting it over here, but it's going over that piece of tape as well. Questions on that? It's all covered. There's nothing that's open. They can walk. Now, sometimes this will peel up while they're walking. You'll need to make sure you tape that back down and make sure there's no drainage coming out of it. Any questions on this? So then you're going to clean up your area. Take off my gloves. Wash my hands. You can put on clean gloves, because remember, we irrigated it, so we have pus on here. She'll lift up her leg. Now, if this is pourable, drippable, flakeable, goes into the red bag, but if it's not, goes into the regular trash. We're going to go ahead and whenever you have a red bag, you want to make sure you're opening it up from the outside. You're going to tie this up, and this is going to go out to the red bag. You're going to cover your patient up, make sure that there's nothing else that they need, answer any questions, see if there's anything. Put them in the lowest position again. Remember, you raise them up. You're going to wash your hands and document. And we'll talk about documentation on Friday. So make sure your ATI is done by Friday.